afternoon. I'd like to welcome everybody here today. This is the inaugural webinar series from the Dairy Beef Short Course. It and the associated podcast will continue focusing on new research and practical feedlot experience as an extension of the annual Dairy Beef Short Course. Today's presenter was Sarah Erickson, TELUS Agricultural Data Advisor. She will be discussing hoof health and lameness in feedlot, feeding dairy crossbred steers. She'll focus on the clinical signs, epidemiology, and treatment and prevention strategies for digital dermatitis, toe tip necrosis syndrome, and foot rot in these feedlot cattle. I've been known every time to tell our presenter, Sarah, the podium is yours.
Thanks, Brett, and thank you for the introduction. So today we'll be reviewing foot-related lameness, as Brett said, primarily foot rot, toe tip necrosis syndrome, and digital dermatitis in feedlot cattle. And this is going to be pretty, pertaining to all feedlot cattle, not necessarily just beef on dairy animals, but our native beef cattle as well. So as we move through the slides, this is going to be kind of tailored the most as we can to the production side and really practical application of how we diagnose these lameness diseases and a lot of the differential diagnoses and what's important there. So to start us off, roughly 30 to 40% of all treatments in feedlots are lameness treatments. So that's second only to BRD in feedlot cattle. And of those lameness treatments, over 70% of them are foot related. Foot rot accounts from about 40 to 90% of those cases, followed by digital dermatitis from about 8 to 26% of those foot-related lameness cases, and then finally toe tip necrosis syndrome, which is about 2 to 4% of cases. And obviously there's variation in there yard to yard and also geographically as well. So a lot of the data that we're going to be talking about today will be related to studies that were done in Western Canada. So there are some confounding factors with the way that our cattle are placed on feed in Western Canada relative to the US. But by and large, these trends should be relatively applicable to any yard kind of thing. So the major impact of foot-related lameness is both from a welfare standpoint and an economic standpoint. So the economic impact, when we look at a finishing animal up to about 1,400 pounds, typically speaking, to get that healthy animal without any health issues to finishing, we're looking at about $520 US dollars per animal. When we start factoring in chronic lameness diseases, that can increase to almost $1,500 per animal, being the cost there. So there is some variation depending on the type of lameness that's involved and whether that chronicity is, a matter of a couple of weeks or whether that chronicity lasts the entire feeding period. So toe tip necrosis syndrome, for example, tends to happen really early in the feeding period. So if you have an animal with that is chronic and takes several months to reach an appropriate weight for slaughter, obviously that price of keeping that animal around and keeping it healthy is going to increase as at the same time. And then from the welfare standpoint, we are touching on all 5 freedoms of animal welfare within lameness and issues that surround that. So to start off, we will talk about necrosis. So the other names you might have heard this by are apical white line disease, P3 necrosis, or foot lesions. This is a non-infectious lameness, so we're not as concerned here about this spreading through the herd from animal to animal. It's more associated with our processing facilities, and the risk factors surrounding that. So by and large, toe tip necrosis syndrome is associated with the abrasion theory. And so this theory suggests that repeated trauma to the hoof wall on things like concrete, the metal slats and some of the snakes and chutes, and that kind of thing can cause damage to the apical white line of the hoof. This of that white line, which allows for bacteria to enter the hoof and start degrading the white line. It can penetrate the hoof capsule and the pedal bone and cause a lot of infection and damage as it moves through the hoof wall. By and large, E. coli and Trupperella pyogenes are abundantly isolated from toe tip necrosis syndrome cases, and these are both highly infectious pathogenic bacteria. So as the clinical signs of toe tip necrosis progress, usually starts with just this separation at the apical white line. So it can be really subtle to see that, especially if you're not able to pick up feet in the chute and that kind of thing. But this is kind of where it begins, with that separation of the apical white line. And then as we move through trimming back more layers of this hoof, we start to see this dark pus of the hoof corium. And this keeps progressing through until we actually see that there's necrosis of the pedal bone itself. So that's what we're seeing here. So although the outward signs of this disease can be really subtle and just seeing those little cracks, the actual underlying issue can be really, really detrimental. And this is most commonly found in the hind feet. See calves that are walking kind of cow-hawked and very, very tender on their hind feet and just tiptoeing along. Really good indication that this could be what's going on there.
Sarah, if we could conserve some bandwidth, go ahead and turn your camera off. We'll get just a little bit of whatever you call it. Thank you.
Sure. Yeah. Let me know if you need me to repeat anything at any time. So as we move into the epidemiology, so I just want to kind of give everybody an overview of what this graph is showing, because we will see this graph repeated several times throughout the presentation for the other diseases. So if we look on our y-axis, we see that this graph is going to 100%. So we are only looking at the cases of these diseases. We're not looking at any population level data. It's just indicating when these cases occur by days on feed, which is on our x-axis, throughout the feeding period. So what this shows us for toe tip necrosis syndrome is that we see over 60% of the cases for this disease occur before 60 days on feed. And so again, when we look at that abrasion theory and we start thinking about when cattle are coming in contact with the type of surface that will cause the degradation of that apical white line, things like concrete, things like the snake in the chute, all that kind of stuff, and honestly the flooring of trucking liners as well. A lot of that stuff's happening very early in the feeding period and when they're being recently arrived. So it makes sense that this disease is very front loaded in the feeding period. What we theorize for the cases that happen after 60 days on feed and kind of later on throughout the feeding period could be relative to rehandling events or revaccination events, those kind of things, where again, those animals are coming through the chute. The other caveat here, when we look at when these cases occur, the temperament of the animals plays a big role in this. So a lot of these beef on dairy animals that are a little bit more quiet, raised in hutch, that kind of thing, we don't see a lot of these cases in them simply because they're not super flighty animals. Whereas when we start looking at some of the native beef populations that, come off of the bush and have never seen people before, they tend to have that more flighty temperament. And so this disease can be a little bit more common in them simply because they're scraping their feet along, trying to move quickly through the processing facilities. So with the management of toe tip necrosis syndrome, as I've repeated a couple times here now, because this disease happens early in the feeding period, it's really important to keep that in mind when we see lameness cases occurring in cattle that are early days on feed. Probably a good indication, and this is not necessarily lightweight calves, it can be any cattle, so there's not really a whole lot of evidence to suggest that this happens more in yearlings than calves or females and males. It's kind of across the board. It can happen in any animal type, but really focusing on those early days on feed. As I said before, animal temperament and handling can play a role here. So practicing really quiet, gentle handling of the animals when they're coming through the chute, something we should be doing all the time, but it is something that's extra important for this disease in particular, simply because we don't want those animals slipping and trying to run as they're being moved through the processing facility. When it comes to treatment of toe tip necrosis syndrome, the most common and efficacious treatment is debriding or trimming the very end of the apical white or the apex of the claw. And in addition to that, including a treatment with a systemic long-acting antimicrobial. So the photo on the bottom right here shows, a good indication of what's correct in terms of that debridement. And this is just to relieve that pressure, let any pus or anything that's hoof capsule to escape. And then the claw on the right hand side of the photo shows when we're getting a little bit too deep and drawing a little bit more blood, and should try to trim a little bit less so than that when treating this disease. It is important to note here that generally speaking, treatment with the long-acting antimicrobial by itself is not sufficient. Debriding of the hoof is a really crucial part of treating this disease. The other things that we can do to try and mitigate the impacts of this disease are things like providing a soft surface layer, so something like sand or manure, especially coming out of the chute when animals tend to try to jump or move very quickly when exiting the processing facility. And also providing a recovery area with easy access to resources. So important that this recovery area, whether it's a chronic pen or a treatment pen, be relatively small so the animals don't have to move around a lot. Providing a lot of good, soft, dry bedding, again, to help with preventing more abrasion on the hoof, and keeping those animals in there, for the sufficient amount of time to allow them to truly recover from it. So now move into laminitis. And so we do detail here, but the general progression of laminitis is that histamine, whether that's caused from ruminal acidosis or from trauma or concussion to the hoof, increases. This causes disruptions in the blood flow of the corium of the hoof, and ultimately leads to the deterioration of the horn capsule corium interface. And that's when we start seeing those really long slipper-like toes growing on these animals. And so the degradation and necrosis of the inflammation of the dermal and epidermal laminae in the hoof wall is a result of that. And again, those elongated slipper feet are a sign of chronicity with this disease. So if we start seeing those animals coming up that have those really long claws, it's a good indication that this disease has been something that they've been battling for quite some time. And there are 3 different severity categories surrounding laminitis. These are mild, moderate, and severe. And so within the mild clinical findings for this disease, it's important to note that there's no other lameness happening at the same time. So obviously, if you have 2 different lameness diseases occurring, one of them being laminitis and one of them being another, then that will ultimately change the treatment strategies and the management strategies. But within the mild clinical findings, we're seeing a shortened stride. It's a little bit more subtle, a little bit harder to note when you're looking at animals in their pens. They tend to have a level back when standing and when walking, and they're still able to keep up with their pen mates. When we move into the moderate clinical findings for laminitis, we're still seeing that shortened stride, and they still are able to keep up with the herd, but we're starting to notice more arching of their back and more reluctancy to get up and move around. So a little bit more reluctancy when it comes to finding resources like food and water. And they tend to shift their weight quite regularly from foot to foot. When we start seeing the actual severe clinical findings of this disease, we're getting to the point where these animals are no longer able to keep up with their pen mates. Their strides become very deliberate. They have an arched back when standing and when walking. They are, again, similar to the moderate level, reluctant to rise and shifting weight from foot to foot, but we really start noticing the loss of body condition and the loss of overall welfare in these animals, simply because they're not able to find the resources. Well, they can find them, but they're not able to access resources very well, simply because they're so sore. And this photo on the right here just really shows what those slipper feet look like when they've grown out to that really severe point. So there's not really any treatment for laminitis. There are a few important things to note about this when it comes to how to manage it, though. So unlike toe tip necrosis syndrome, where we're seeing really early days on feed case increases, Here we are looking at more late days on feed. So this is occurring as cattle are moving later into the feeding period, and it's actually more commonly observed in heifers. And this is actually specific to heifers that are in the light sort group on their terminal sort, because they've been on the feeding period or on feed for longest, and being a part of that light sort group means that they're still kind of, to get to the actual appropriate slaughter weight, they're going to be there for some time, and relative to steers just not gaining at the same rate. So most commonly those late days on feed heifers is where you're going to see this disease. And really the only management strategy for laminitis is shipping those cattle prior to them becoming severely laminitic. Obviously, there's going to be issues surrounding the severely laminitic animals and their ability to actually load onto a cattle liner, and the welfare issues surrounding that. So it's really important to try to manage either the sort groups on those terminal sorts for these animals, and the weights to get them shipped or railed appropriately before it's too late, kind of thing. So whether or not the yard that you're working with has railing options close by, or those are important considerations, because sometimes that's not overly feasible for each yard. And generally, this is when we're thinking about shipping these cattle earlier and thinking about railing them, that's going to apply to those mild and moderate cases. We generally don't see a lot of the severely laminitic cattle actually making it onto a truck. And unfortunately, those animals ended up resulting in euthanasias and losses for the feedlots. So part of the management strategy on shipping these animals is potentially moving them up a market group as well, so that they're shipping earlier and that kind of thing. This note that I have on the bottom here, the amount of the law average data gain per day on these animals is not published data. This is something we've kind of looked at a little bit internally within TELUS Agriculture, but we're kind of that rough estimate that we're losing about half a pound a day on these animals due to the fact that they can't get up and access the resources that they need appropriately. The overall economic impact of laminitis, it depends on the percent of the production lot that's affected. So we tend not to look at this disease on an individual animal basis. It's more the economics are surrounding the entire production lot that is affected by this disease. So next we'll move into foot rot. And so now we're moving away from the non-infectious diseases being toe tip necrosis and laminitis, and we're moving into those that are infectious and can spread through the herd quite quickly. So foot rot is also known as interdigital necrobacillosis, infectious bovine pododermatitis, or foot abscesses. Fusobacterium necrophorum is the primary pathogen involved in this disease. However, there are secondary pathogens that are seen quite commonly occurring. Usually we're seeing that the secondary pathogens, especially the Prevotella pathogen, we don't isolate those from foot rot cases by themselves. They're always in conjunction with Fusobacterium necrophorum. So a lot of the theories surrounding that is that those secondary pathogens are actively involved in this disease, but the Fusobacterium necrophorum is always involved in it. And so generally speaking, similar to toe tip necrosis, injury to the hoof is what allows entry for these pathogenic bacteria, but a little bit differently here in that we're looking at the actual interdigital cleft, so the space between the hoof claws, and that's where that damage is occurring and where this disease is most commonly diagnosed. And again, unlike the other two diseases that we've discussed, foot rot is highly infectious and contagious. We move to clinical signs. We tend to see symmetrical swelling at the coronary band. So we don't often see swelling in the other diseases that we'll be talking about today, especially not to the extent that we see it with foot rot. And so swelling can extend into the heel and between the claws. So if you're seeing an animal that's got a really swollen, usually a back foot, a lot of the time it's a good idea to find out whether or not that's a foot rot case you're dealing with. The lesions for foot rot can vary from about 1/4 of an inch, less to 1/4 of an inch, to the entire length of the interdigital cleft, as we're seeing in the photo on the right here. And most commonly, that is resulting in necrosis and sloughing of the subcutaneous tissues. And there's usually a really strong foul odor associated with this disease as well. So that's a really good indication if you're getting that foul odor when you're bringing an animal through the chute, it's most likely foot rot that you're dealing with. And as I said before, it's most commonly a hind foot and usually only a single foot affected. We don't often see more than one foot on the same animal affected here. Chronic foot rot cases. So if treatment isn't done efficaciously enough or quickly enough, the chronic progression of foot rot can result in abscesses. And so this can lead to deep digital sepsis within the hoof joint. And a lot of that can actually extend into crepatitis that moves all the way up the hind limb or the front limb, depending on which foot is affected. And this can also result in septic arthritis. So we see cases of feedlot cattle where there are septic arthritis or there is septic arthritis occurring. Oftentimes it's been a foot rot case that developed into that. Some of the risk factors surrounding foot rot. So most of these are going to be things that cause that damage to the interdigital cleft. And so if we think about weather fluctuations and moisture increases, this disease is often considered a seasonal disease because of those things, but it's not necessarily the weather itself causing it. It's the things that it's causing within the pen environment. So things like dried mud, frozen uneven ground, ice, all that kind of stuff that can cause a lot of damage to the interdigital cleft, as well as the moisture increases that always keep the hoof wet and kind of that soft, more easy to damage feel about it. And so that injury to the interdigital cleft allows the entry point for the pathogenic bacteria that we talked about before. And there's a lot of conflicting research on whether or not this disease happens more commonly in, steers versus heifers, calves versus yearlings. And of the research that's conflicting surrounding whether or not it happens more so in calves versus yearlings, a lot of those default to temperament. So similar to toe tip necrosis syndrome, there's a theory that the flightier, more wild animals are going to be more likely to get this disease. But depending on which research you're actually looking at, some people say that that's calves because they haven't been around people for longer, or yearlings that have been out on grass and again, not around people. So there's a lot of conflict back and forth there. But by and large, we do see this disease pretty well in any animal and also at any days on feed. So we'll get into that next. So again, this is the same graph that we're looking at for the toe tip necrosis syndrome, being that we're only looking at the foot rot cases and when they occur throughout the feeding period. Unlike the toe tip necrosis syndrome graph that was really front end loaded, we're seeing that foot rot cases actually occur pretty constantly throughout the feeding period. There is a level off later days on feed, and part of that is because the actual population at risk or the number of cattle on feed at 300 plus days on feed is simply lower than the number of cattle that were on feed at lower days on feed. And that's part of the reason why this graph levels off later in the feeding period. But if we look from about 0 to about 220 days on feed, we're seeing that these cases are happening very consistently throughout the feeding period. Being that this is a seasonal disease and weather plays a big role in that, we will see some fluctuations month to month. So in Western Canada, for example, when we are dealing with constant freeze thaw cycles in the spring and late winter, early spring, oftentimes we'll see foot rot cases increase because of that, because the pen conditions are poor and we have that cyclical problem with ice and dry mud and kind of flipping back and forth between those two throughout the spring. So it's important to keep that in mind, that if you see lameness cases increasing after a weather event, or if you've had, a particularly bad season where pen conditions have been really poor, it's a good indication that foot rot's what you've been dealing with. So given that Fusobacteria is the most common pathogen associated with this disease, there is a vaccine that's licensed for the prevention of foot rot. Unfortunately, this vaccine is not very efficacious in cattle, or in feedlot cattle, that is. There is a lot of success with this vaccine in cow-calf. A lot of people use it on their herd bulls, that kind of thing. But we've seen in some of the research surrounding the efficacy of this vaccine is that in feeder cattle, especially those that are on a high-grain diet, which obviously is all of our feedlot animals, the actual efficacy of this vaccine decreases quite significantly. So unfortunately, not the best option there for use in feedlots. The treatment success for foot rot depends very much on early detection and rapid intervention. So this is really important, not just on the individual animal base, but on the pen level. So if you start seeing foot rot cases increasing, it's not a bad idea to run the whole pen through and do that as a preventative measure, or you can pulse CTC in their feed, something like that, to try and get a handle on it before the whole pen breaks, because we do find that this disease spreads very quickly and can result in the whole pen being affected very, very fast. One of the best mitigation strategies in terms of keeping the pen conditions dry and providing a good bedding surface is mounding the soil. So the photo on the bottom right here it's not the best photo, but you see the kind of the mud in the background, and then where the soil in the pen has been mounded up, and the calves standing up on that mound out of the mud, keeping their feet dry, that kind of thing. This also can act as a pen enrichment thing too. They really like, scratching and rubbing their heads on these mounds and that kind of thing too. So and this is really important, especially in any of the yards dealing again with those freeze thaw cycles in the late winter, early spring. When it comes to the chronic cases of foot rot, similar to laminitis and, well, similar to any lameness disease, railing and euthanasia are really important things to keep in mind with this, especially before we get to that case where there ends up with septic arthritis and the animal absolutely has to be euthanized because it can't be loaded on a truck and that kind of thing. And so lastly, we're going to talk about digital dermatitis. And so the other names that this disease is commonly called is papillomatous digital dermatitis, hairy heel warts, or strawberry foot rot. And those last two are kind of the most common names that you'll hear it by. Similar to foot rot, this is a highly contagious disease. Digital dermatitis is multifactorial and polybacterial, meaning there are a ton of different risk factors that go into how this disease progresses and the etiology of it. And there are multiple bacterial species that are considered to be playing important roles in this. Of the bacterial species that are most common or that are involved in this disease, the treponeme species are most common. Digital dermatitis is considered to be an endemic disease in the dairy industry, meaning that it is seen pretty much industry-wide in the dairies, and it's something that they are constantly dealing with. But it's considered a growing concern in feedlots. So not every single feedlot sees this disease. The ones that do, unfortunately, see a lot of it. And so that's kind of what we're going to review a lot today, is the management strategies of how to mitigate the impact of this disease in a feedlot, the challenges surrounding that relative to the challenges that are seen in dairies. And so we'll kind of, as we move through that, just highlight some of the differences in dealing with this disease between those two industries. And as I said before, the treponeme species are thought to play the most important role in the pathogenesis of this disease. So digital dermatitis happens in 4.5-ish different stages. So the 4 stages of the disease that are considered active, meaning that there are lesions that are actively growing, actively painful, that kind of thing. There's 3 of them. So our M0 here is obviously just our healthy foot, just for that visual comparison. The first active lesion stage of digital dermatitis is this M1 stage. And so we're seeing a circumscribed area. So usually it's round or ovular in shape. It tends to have this kind of mottled gray color around the outside of it. And this can be about 1/8 of an inch to an inch in diameter. So it can be quite a large lesion, but it can also be very subtle. When we start moving into the M2 lesions, so in terms of the actual like disease progression and what's happening at the surface layer, very similar, but these M2 lesions tend to be greater than an inch in diameter on the back of the hoof there. And the last active lesion stage for digital dermatitis is this 4.1 stage. And so this one's a little bit different because we will talk about the M4 stage on the next slide, but that's our chronic stage. And the M4.1 is where we start seeing new M1 lesions, so being that, about 1/8 of an inch to an inch in diameter, growing on top of a chronic lesion. And so this is really important to keep in mind for the management of this disease, because we'll see that chronic lesions, they might not necessarily be shedding the disease at the time of that chronicity, but as they start moving into these M4.1 stages again, that's where again we start seeing more of that shedding of the species that are involved in the pathogenesis. The two chronic lesion stages, or the two inactive lesion stages of digital dermatitis, are the M3 stage and M4. So the M3, kind of hard to see here, but this is essentially a lesion that has scabbed over and is healing. So if we see these lesions, good indication that our treatment's been working, and generally speaking, these lesions are not painful anymore, and they're on their way to recovery. The M4 lesion is where we start seeing the actual skin growth, so the hyperkeratotic growths and the hair-like proliferations surrounding the lesion. And so this M4 is where we get the nicknames of hairy heel wart for this disease, as we start seeing that weird mottled hair-like projections on the lesions. The really important thing to note on M4 is that, similar to the healing lesion, these ones tend not to be painful, but they can still play a role in spreading the disease throughout the rest of the pen. So this is one of the biggest challenges with digital dermatitis, is that the animals might not actively be lame because they might be in a chronic state of the disease, but that doesn't necessarily mean that they're healed, and it doesn't necessarily mean that they're not spreading it to their pen mates. So that can be really challenging when it comes to treating this disease, and when it comes to actually getting rid of it within a pen, because it can be really hard to tell which animals are still actively affected by it. Similar to foot rot, some of the risk factors surrounding digital dermatitis are pen hygiene. So again, we're thinking of that moisture level, mud, manure. A little bit differently than foot rot, we're not so much worried about the damage being caused to the hoof here. It's more that high levels of moisture and mud and manure can act as a reservoir for the treponeme species that are being shed from the lesions. And so we have animals walking through that slurry that has the bacteria in it, and that can help, or that can increase the likelihood that this disease is going to spread to other animals in the pen. And that's the same whether you're in a dairy or in a feedlot. It tends to be a really big factor for the spreading of this disease. Because digital dermatitis is endemic in dairies, there has been some speculation that dairy cattle are the cause of this disease starting to emerge in feedlots, especially as we have more of the beef on dairy cattle being placed on feed and increasing numbers of those seen in feedlots. However, there's research that suggests that might not be accurate. So some of the research that we did for my master's degree a few years ago now here was, we looked at whether or not we had a higher risk of developing digital dermatitis in beef animals versus dairy animals, and we didn't find anything significant there. And so part of the speculation that we came up there with why that wasn't the case is the use of calf ranches. And so, although this disease is endemic in dairies, we're seeing it lots in the adult dairy populations, that kind of thing. If you think about a day-old calf that has been removed from the dairy and moved into a calf ranch, where it's essentially in an isolated hutch for the first, portion of its life, there's a lower likelihood that that animal was actually in contact with an EDD when it was initially at the dairy for that first day or two of its life, kind of thing. And so the likelihood that that calf then brought DD with it to the calf ranch and had it there and then eventually brought it into the feedlot once moved to a feedlot is pretty unlikely. I think there probably is something to be said for older dairy calves that are moving into the feedlot. If they've spent time at the dairy and been in contact with other animals that had DD at the dairy, then maybe that's where that speculation can come from. But I think if we're talking about calf ranches and we're talking about these little day-old calves that really haven't spent much time in the dairy, the likelihood that they are introducing DD into the feedlot is probably a little bit lower. One thing that we did find in my master's research was that there is a higher risk of DD in heifers than there is in steers. And so this is really interesting because if you think back to the laminitis slides that we reviewed, we saw the same trend there as well, that heifers are more commonly afflicted with laminitis than steers. And we're seeing the same thing in DD. And so one of the other things that we found that was interesting with this is that as the amount of DD that's diagnosed within a given year increases, the risk in heifers increases even more so. So in a year where you had a lower case count, the heifers are still going to be higher risk than the steers, but it's not a dramatically higher amount. Whereas in a year, if you have a really high caseload, the risk in heifers increases quite dramatically over the risk in steers. We also found that there was a higher risk of developing digital dermatitis in grass cattle and those that were backgrounded in confined pens versus cattle that came from auction markets. So we analyzed this looking at auction calves, ranch direct calves that would have come straight from a ranch with no intermediary in between the auction markets, or these grass cattle or backgrounded cattle that in theory would have went from a cow-calf operation into the backgrounder where they would have been commingled with other animals from different cohorts and then moved into the feedlot. And so that increased level of commingling is what we think is contributing to this. And with both within the grass cattle backgrounding system and within the confined pen backgrounding system, that commingling is playing a big role. What we think in terms of the backgrounded in confined pens having a higher risk than cattle that were backgrounded on grass is that the ones that are in confined pens are again dealing with the potential for pen hygiene issues and increased amount of mud simply because they're being housed in a smaller area versus those yearling grass cattle that are out on grass and most likely not having the same impact of poor pen hygiene occurring within them. So again, we're going to look at the epidemiology here of when these cases are occurring throughout the feeding period. So again, we're seeing a big shift here where we had toe tip necrosis happening really early in the feeding period and foot rot happening throughout the feeding period at a pretty constant rate. Digital dermatitis is the opposite. We are seeing less than 10% of digital dermatitis cases happen before 80 days on feed. So good thing to keep in mind when you are diagnosing lameness early in the feeding period, or even within the first 80 to 100 days, pretty good chance that it's not DD. There might still be some cases for sure, but generally speaking, this disease is going to start increasing later in the feeding period. And so a really important differential there is that if we think back to laminitis, laminitis is also seen late in the feeding period and also seen at a higher proportion in heifers. So really important to keep that in mind when diagnosing late days on feed lameness cases. There's a pretty good chance that you need to be very careful in diagnosing that as a foot rot case, a laminitis case, or a digital dermatitis case. And especially when we start getting into the animals that have more than one disease happening at the same time. So we'll see here that after 80 to 100 days on feed, the majority of the DD cases are occurring quite late. And again, we're seeing that leveling off later in the feeding period simply because we just don't have as many animals on feed at that time. But really important to note that these are happening late days on feed. So when it comes to managing DD, we do have treatment strategies, but the management is a really important one when it comes to mitigating the effects of this disease. There are a couple research articles out now that look at feeding increased organic trace minerals, specifically zinc, might be preventative. Interestingly enough, two of the studies that looked at this, one looking at it in steers and one was looking at it in heifers. The study that looked at the steers did find a significant decrease in the amount of DD that was occurring in the steer population. But interestingly, using the exact same organic trace mineral in the heifers, the impact was not as, or the preventative measures were not as good with the organic trace minerals in those heifer populations. So I think more research is needed there, but this might be something that eventually becomes a more proactive measure against this disease. But it still remains to be seen of whether or not that's going to be something that can be used in both heifers and steers. Really important when diagnosing DD and when treating it is that we wash the foot off. So we want to make sure that there's nothing stuck in between the claws. There's not a lot of mud built up around the hoof. And so unfortunately, this ends up being a bit of a time crunch on feedlot crews, because the best way to treat this disease is to actually lift the foot up. So if you have like a winch system or something like that, be able to wash the foot off and apply topical tetracycline or copper compounds. So some conflicting research on whether or not including systemic antimicrobials is important here, but almost all research agrees that the topical application of antimicrobials to the digital dermatitis lesions on the hoof is the best way to treat this disease. And we talked about this a little bit before when we were going through the different clinical signs, but these chronic and unresolved lesions can be really common for starters, but they also act as a reservoir for this disease. So I mentioned that before, where on those M4 lesions and the M4.1 lesions, we often see that those animals aren't as lame. It's not as obvious that they're still dealing with the disease, but they really can be propagating the spread of that disease throughout the rest of their pen. Similar to foot rot, mounding the soil to create those dry areas within the pen really helps, and providing a really high quality bedding surface as well. And again, just that's, in the efforts to decrease the amount of moisture in the pen and decrease the reservoir that mud and moisture and manure can act as in spreading the disease throughout the pen. If possible, and now I understand that in most feedlots, this isn't really a feasible thing, but if possible, if you have a pen that has a high amount of DD, once that whole pen has shipped, or that whole lot, depending on how you place cattle throughout the yard, if you have the ability to scrape that pen completely dry and leave it dry for 1 to 2 weeks, that's really helpful in reducing the amount of treponemes that could still be existing in the soil and preventing future pens from also being affected by it. The most common management strategy for digital dermatitis in dairies is the use of foot baths. And this works really well in dairies because the cattle are able to move back and forth through a foot bath multiple times a day, especially if they're moving into the milking parlor and that kind of thing. Unfortunately, in feedlots, this is not very easy. It is the closest thing to a mass treatment for DD, however. So in yards where we're having a lot of DD cases, it is really important to try and implement a foot bath because it can really help reduce the amount of this disease. But there are a ton of considerations for feedlots in how a foot bath can be effectively used. So location's really important here. Obviously, we want this in a spot where cattle are going to be moving through it. The size and the depth of the foot bath is really important too. So we need to make sure that not only is it deep enough that their foot can be fully submerged, but it also needs to be long enough and wide enough that they can't jump it. And so that every single one of their 4 feet actually makes it through the foot bath as they're walking through it. This also poses the issue of use and frequency of use of the foot bath. So generally speaking, the recommendation is to change the foot bath liquid after every 100 head go through. And so for some large pens, that's not a feasible thing, right? Because you're not going to stop, after every 100 head in a pen that has 300 of them in it kind of thing. You're wanting to try and keep the animals moving and that kind of thing. So that becomes really challenging as well. because as the amount of mud and manure and everything increases in that foot bath, obviously the concentration of the solution that's meant to be helping to prevent the DD is decreasing, and just not as effective there. And so that ties into the maintenance of these foot baths as well, being that cleaning them out can be very time consuming, especially if it's after every 100 head. The disposal and the management of the foot bath liquid can be very challenging, as this can often be carcinogenic, or it can have a lot of environmental implications. And the other one that's an important consideration here that is not a consideration for dairies is weather. And so we have a couple yards in southern Alberta that have implemented foot baths. And one of the biggest challenges they come up with is that they freeze when it's really cold. And so that becomes an issue as well. And so, this is, like I said, it is the closest thing we have to a mass treatment for DD and the best thing we have for a mass treatment, but implementing them into a feedlot can be really challenging. So that will kind of go through the main takeaways here. So laminitis, foot rot, digital dermatitis, and toe tip necrosis syndrome are most common forms of related lameness in feedlot cattle. Toe tip necrosis syndrome is non-infectious, associated with damage caused by abrasive surfaces in the processing barns or in the feedlot itself. And soft surface layers can help to mitigate this, really most commonly happening early days on feed. Laminitis is a metabolic disease, again, non-infectious, associated with high grain diets. Laminitis and digital dermatitis are both commonly observed at late days on feed, so that's an important thing to keep in mind when differentially diagnosing between those two diseases. Foot rot and DD are both associated with poor pen conditions, but slightly different reasons there. Foot rot being that it can be because of the damage that poor pen conditions can cause to the hoof, and DD really associated with the fact that moisture and mud can be a reservoir for the treponeme species that result in the spreading of those diseases, or of that disease. And for digital dermatitis, sex and acquisition source are really important risk factors in how that disease impacts different populations within the feedlot. When we talk about the differential diagnosis of these 4 diseases, so we've kind of touched on this throughout the talk today, but it's really important to keep in mind how difficult it can be to effectively diagnose these. And so this is a photo that a colleague of mine at TELUS Agriculture has on a whiteboard in his office. And I just think it's perfect because it shows how much of a mess these diseases can be and how difficult it can be to appropriately diagnose them, how difficult it can be to manage them. And so it totally looks like a crazy man's diagram, but that really ultimately is what this can become if not diagnosed correctly and if not managed well. And so the biggest things here is that foot rot and DD are infectious and may spread rapidly. So active treatment, early diagnosis, and pen interventions are really important there. Toe tip necrosis syndrome, early days on feed, can be in any cattle type. So important to think about that at the early stages of the feeding period, that keep this disease in mind. Foot rot can be pretty well any days on feed, and again in all cattle types. So that one's a good one to have in mind throughout the feeding period, and especially thinking about those different weather fluctuations. So when pen hygiene decreases, good thing to keep in mind that this disease might be affected by that. Laminitis and DD are both late days on feed and tend to be in fat cattle, but particularly in heifers. And so really important, again, as I've mentioned a couple times now, if you're seeing lameness late in the feeding period, really focus on trying to figure out whether or not that is a laminitis case that needs to be managed in terms of the terminal sort groups and getting those cattle shipped or railed as soon as possible, or whether this is a DD case that needs to be treated. And so, we don't want to run into the situation where somebody is under the impression that this is a DD case, so they've treated that animal and treated it and treated it and treated it, only to find out that that animal actually was laminitic and could have been shipped earlier and could have been railed prior to ultimately needing to be euthanized, and then that being an additional cost for the producer. And so, yeah, just to, again, drive that point home, the differential diagnosis of these diseases is the absolute most important thing when it comes to preventing, treating, managing with a feedlot. Again, just to touch on the treatments. So we're going to debride the end of the hoof and administer systemic antimicrobials for toe tip necrosis syndrome. Laminitis, we are going to manage by shipping and affecting the cattle prior to them becoming severely laminitic. Foot rot, we're going to treat with systemic antimicrobials, and we are going to aggressively and mass treat pens with increasing cases to prevent the spread. Digital dermatitis, we're going to go to that topical treatment, washing the hoof off, applying the topical treatment, and potentially adding in a systemic antimicrobial. So there is some evidence that that's a valuable thing to do to treat DD in conjunction with the topical treatment. And this is also really important, especially if foot rot is present. So we often do see cases where an animal has both foot rot and DD on the same foot, and those systemic antimicrobials are really important there. Foot baths are our best mass treatment for DD, but again, a lot of considerations of whether or not these are feasible to do in feedlots. And again, just to talk about the pen management strategies, mounding that soil to help keep a dry area that the cattle can bed down on and keep their hooves dry is really important. And that's both for foot rot and for digital dermatitis. And with that, I'll take any questions.
Sarah, thank you very much. We appreciate the information you brought forward. I think, Madison, I think we got at least one question in the queue.
Yeah, there's actually two. I got a direct message earlier in your presentation, Sarah, and it pertains mostly to the idea that we were talking about trimming early on, of kind of managing some of these things and using that as a tool in our toolbox. But this kind of goes into what equipment would you recommend to hold the foot safely, as it seems our regular squeeze chutes seem to be narrow and not necessarily the best setup for it. So they were kind of curious what equipment you would recommend in that trimming process.
For sure. So we actually have a couple of yards that have basically used a winch. So it's a winch that they've mounted up onto the back of the chute, and they can move it if they need to use this for a front hoof as well. But they have it mounted kind of on the back of the chute where they can then, like, it's just like a wide enough piece of rope that they can put around the fetlock of the animal's hoof, and then use that winch to slowly lift that hoof up, kind of thing, while the animal's squeezed in the chute and can't. Obviously, you don't want them hurting themselves by trying to jerk that leg away and that kind of thing. So that tends to be the best. We have done some where, you know, it takes a little bit more of elbow grease and you're trying to lift that foot, and then just kind of looping a rope around part of the chute, again, putting it around the fetlock lower down, so you're not causing any damage higher up on the joint or anything like that. And just kind of having to wrestle with it a little bit. But that winch system we find is the best if you don't have something like a tipping table, you know, accessible and that kind of stuff. I mean, obviously that's the gold standard, but again, not overly feasible in a feedlot setting.
Kind of making work what you've got and kind of altering those systems in a you know, safe way for everybody.
Yes,
seems to be
exactly.
the cowboy way to do things, and it works fairly well, so can't really complain there.
Absolutely.
I will give a preface to anybody that's still hanging around for the question part, that if anything comes up, feel free to put it in the chat and we can talk about it. But in terms of what another one that kind of came through is, you talked about using CTC in the feed to treat and kind of use that. Is it effective in the feed, and kind of at what levels does it seem that works the best, I should say? And then kind of adding to it, do you need a script to use it in that way?
Yeah, so I'll you know, preface this by saying I'm not a veterinarian. So obviously this would be a discussion that you would want to have with your feedlot veterinarian. They would be the expert on the levels and whether or not you would require a script to do that. We have seen some efficacy with this, and it kind of it varies on how many cases you're seeing within those pens. So again, that's kind of an important management strategy for foot rot. If you start seeing cases really increasing, that might be a good option. But again, you'd have to work with your veterinarian to in terms of which levels and that kind of stuff to appropriately use.
Yeah,
I,
I guess Fred, if you don't mind, I will keep the mic for one more question. It's kind of my personal curiosity. So I mentioned earlier, for those who were on early, that where I'm located in Watertown, South Dakota, we recently just got a good shot of rain, which was something we definitely needed, but definitely came down and now has made some mud, at least for a little bit of time till it soaks into the dry ground. But do you find that sometimes these foot issues don't necessarily correlate directly to the mud that sometimes we relate them to, and that sometimes they even happen during the dry seasons or even during dry weather? Or do you have any kind of insight on that?
Yeah, absolutely. So we do see foot rot cases in really dry periods where there's a lot of like when the ground's really hard and again can be really abrasive and that kind of thing. We still see the cases occurring there. It just seems to be that there's a higher rate of it occurring with the moisture changes. And again, as I had mentioned a couple of times, especially in Western Canada, we really see that with that freeze thaw cycle where the ground's going from being really, really wet, where they're, up above their fetlocks in mud to all of a sudden it's frozen solid again and really abrasive and that kind of stuff. But yeah, that's not to say at all that the dry periods don't also propagate that. I would say less so for DD because the reservoir of that mud and manure housing the treponemes is not going to be as much so in a dry period. And actually the dry would be better for mitigating DD because it's going to help keep the pen more hygienic in that sense. But yeah, the foot rot cases we still see those in the dry periods as well.
I had a question come in. You'd mentioned a couple of topicals in the foot bath. Is there a dry application that you could use a powder box as opposed to a foot bath?
Yeah, so I think there are some powdered antimicrobials. The most common one that we've used for treatments in our yards is actually just like a cyclo spray. So it'd be like your like aerosolized canister of a tetracycline antimicrobial. And that one seems to work really well on those individual treatments. As far as the mass treatment, I'm not sure if there's anything. There's been some individuals that have attempted to use lime in pens, especially after they clean the pens out, they'll lime the pen. Not a whole lot of knowledge there on whether or not that's really helpful kind of thing. But yeah, as far as that mass treatment goes, really foot baths are the only big one kind of thing.
We talked a little about some potential differences on the dairy beef cross. Are there differences between the native cattle breeds?
I don't not not really, no. So I would say like it's more the differences in the fat cattle. And so I think that's where we see the differences in the steers versus heifers, that the heifers to reach that same slaughter weight are on feed for longer. So we don't often see as many cases in the steers as we do in the heifers, but I would say that weight plays a larger role in breed. The one caveat there would be toe tip necrosis syndrome, where that can be, again, it's more dependent on temperament kind of thing, right? So I think that's why we don't see as many cases in these beef on dairy calves because they tend to be a little quieter and they just don't. If anything, they don't really know how to be calves, right? They're let alone how to run away and that kind of thing. So I do think that one plays a big role there. But as far as actual differences in breeds in terms of how genetics would play a role, I'm not sure that there's been a whole lot of research into that.
Very good. Now, I've got just one old man question here. I was a feedlot kid in north central Iowa, and other than injuries, I don't remember a lot of lameness in the cattle that went through our yard. Has this changed over time?
Yeah, I would think so. there was a study from 1993, and in that one they had projected like only like it was under 2%, I think, um, of lameness cases, and it was a really low proportion relative to the other diseases that were occurring in the yards. And we've seen that, like in the research that I did for my master's degree, we saw that, you know, lameness cases have increased to the point where 40% of what's treated in a feedlot tends to be lameness, second only to BRD. And so whether that means that the actual cases are increasing or whether that means we're getting better at detecting it, I think it's probably a bit of both. Especially when it comes to digital dermatitis. This is one that's in the past few years is really starting to gain traction and really starting to be something that we're recognizing in feedlots. Personally, I think it's been there a lot longer than we've thought it has been. And I would think that a lot of yards that have been dealing with lameness regularly have probably had cases of it, but without the knowledge and education on how to diagnose this and that kind of stuff, I think a lot of it ends up getting diagnosed as foot rot. So one of the numbers that I had up in the early part of the presentation was that foot rot accounts anywhere from 40 to 90% of the hoof-related lameness cases. I think that that's probably an overshot. I would think that DD and laminitis, well, DD and toe tip necrosis syndrome probably have a higher amount, but when it comes to diagnosing them, in, you know, for example, our TELUS agriculture shoot side system only allows for one diagnosis. So if you have an animal coming through that has foot rot and DD in the same foot, chances are they're only entering one of those, and 9 times out of 10 it's the foot rot one that gets recorded, kind of thing. So bit of both, to answer your question more directly. It just, I think we're getting better at diagnosing them, getting better at differentially diagnosing them, but I do think the actual amount of them occurring is increasing as well.
Anyway, go ahead, Madison.
I was just gonna say, in the chat there was kind of a good additional conversational point to that of during that time that you're kind of talking about, Fred, here, of we weren't necessarily marketing cattle to the weights that we are now. They're not getting as big and heavy and on feed as long for that same, and we're kind of a different production phase too. So that was kind of something that might kind of bring itself into the conversation too, is just how we're managing cattle and the goals that we're going for might be a little bit different, and might be impacting what we're seeing on the production end in terms of foot and lameness issues.
No, I completely agree, especially when we're looking at those late days on feed cases in heavy cattle, for sure. I would completely agree with that.
We also had one more comment there in the queue that there is no clearance for CTC for foot rot in the United States. So obviously that's a conversation with your feedlot veterinary to confirm
Absolutely.
what is actually ethical to be used.
For sure.
Okay, thank you again, Sarah. We appreciate the knowledge you shared with us. I mentioned early on, this was the inaugural Beef on Dairy dialogue webinar. We have the next one scheduled for June 17th, and the folks who have registered will get a short newsletter that kind of outlines what was talked about today and gives Melanie's information about what folks will hear in June. So Madison, unless you have a closing comment, or Sarah, we'll
I was gonna say the only closing comment I had is I got kind of another little conversation point that if we want to take 30 so seconds, it's just are we worried that using CTC will create more antimicrobial resistance? Because globally that's something that we're kind of concerned about moving forward. I'll kind of give my thought process on it too, and I'll gladly hear from Sarah or Fred or anyone else of I think there's always risk of having antimicrobial resistance when we start using drugs to treat things. But I think as long as we're being courteous of what we're treating and properly identifying those things, I think that can go a long way of these drugs being able to remain on the market, and be able to be used for other things. So that's kind of my little thought process. Sarah, I don't know if you've have anything else to kind of close out conversation before we let folks get back to their busy days, but that was kind of the last little tidbit I've got for you.
Yeah, no, I'd agree with you, Madison. And yeah, no, I just wanted to thank everybody for your time today. And if there's any follow-up questions, don't hesitate to reach out. I'm more than happy to continue conversations on about this.
Very good. Thank you again. I appreciate everybody who showed up and look forward to seeing folks next month.